Dr. Kerry Chant from New South Wales Health with the COVID update for Monday the 13th of December 2021. There were 536 cases of COVID reported in New South Wales in the 24 hours to 8 p.m. last night, and there were almost 75,000 COVID tests reported during that period. Thank you to everyone who's presented for testing. It's going to be essential that we maintain those high levels of testing. In relation to the Omicron, there were 64 cases of COVID with the Omicron variant detected in New South Wales. 17 of these cases were acquired overseas or on an international flight, and there were 47 cases were locally acquired. However, we do know that there are a number of tests that are pending for the genomic sequencing, and we are expecting those numbers to actually jump quite significantly as those tests are performed. And we have seen a number of local hospitality venues, in particular, that have been linked to Omicron clusters. There are currently 171 cases admitted to hospital, with 24 people in intensive care, 9 of whom require ventilation. There has been also our vaccination coverage continues to increase, with 94.8% of people aged 16 and over having received their first dose of the COVID vaccine, and 93.1% are fully vaccinated. And 81.4% of 12 to 15-year-olds have received a first dose, and 77.7% are fully vaccinated. We have updated our advice in relation to the Argyle nightclub in Newcastle. Yes, last night we issued an alert indicating that there'd been 24 people linked to the nightclub that have tested positive for COVID, and we believe these cases are linked to the Omicron variant. But overnight we've also seen a number of new cases detected through people coming and presenting for testing, and there's around additional 60 cases that again are likely to be of the Omicron that are going to be linked to this outbreak. So I can't stress this enough, that all of those people who attended, the 680 people who used the QR codes, or if you know of someone who didn't, or you yourself didn't check in, it's incredibly important that you isolate and get a test. We're also asking that, given the high transmission at this venue, we're asking household contacts of anyone who attended to also immediately get a test and isolate until they and the close contact test negative. These steps are essential so we can slow down the transmission of the Omicron variant in our community and of COVID generally. With this transmission we're seeing at a number of social events, it's important to keep up our COVID-safe practices during the festive season. Please do not attend any function if you have any symptoms, however mild. And also, if you have the opportunity to be selecting venues, choose outdoor venues or well-ventilated spaces, airy spaces, as they're more COVID safe. Also, we are asking that you consider doing a rapid antigen test before going out, even if you don't have symptoms. So remember, if you have symptoms, you need to have that very sensitive PCR test, which is the nose and throat swab. And also, if Public Health have asked you to have a test, that's the test you need to have. But if you don't have any symptoms and you want to have that added assurance, then it's important that you present that you can use the rapid antigen tests. And they're available in pharmacies and supermarkets, and widely available. There's some instructions on the New South Wales Health website on how to use them, and also some tips about the sorts of situations where rapid antigen testing can be useful. Again, can I just stress again, do not use them if you have symptoms. You must do the more sensitive test. Another thing that we know that will help protect us against COVID is having boosters. So we know with the Omicron variant that the vaccine effectiveness against the Omicron variant is likely to be less than the previous strains for which the vaccine was developed against. And so it's important that we take up that opportunity for a booster when we are eligible for that. ATAGI updated its advice on the weekend to make it clear that the booster interval is 5 months. So I would urge everyone to make an appointment over the coming days and get vaccinated before Christmas, before we've got those events where we know we're going to be interacting with broader social networks over the Christmas and New Year periods. Also, I would strongly recommend that people aged 12 years and over who are severely immunocompromised or are taking special medication that suppresses their immune response, or have cancer, particular types of cancer, that they talk to their doctor about whether they actually need a 3rd dose as part of their primary course. Seek advice from your GP, because it may be that you're recommended for a 3rd dose as part of your primary course, and that can be given in an interval of 2 months after your 2nd dose. So please don't delay, please check in and get vaccinated as soon as possible. Can I thank you again for your efforts to get vaccinated, to get tested, and for helping to limit the spread of COVID. We do want to see those numbers as low as possible over this period. So that just those simple practices of wearing a mask indoors, not going out and about when you've got symptoms, instead isolating and getting tested, choosing those outdoor environments for large gatherings, can really contribute to keeping the spread of COVID limited, and therefore, as we're learning to live with COVID, reduce the stress on everyone. Thank you.